Well, I think, yeah, Capivasertib is the only drug that will be there if somebody has a PTEN loss or an AKT activating alteration. I think, those represented a smaller portion of the patients on each trials, but it's definitely something we should pay attention to. And, as we step back and reflect on the entire pathway, each drug now, we have so many drugs hitting different parts of this, and with the alpelisib being isosome specific, but still is an orthosteric inhibitor, and so we see a lot of the on-target effect with hyperglycemia, and so it's interesting as we get some of these allosteric and the allosteric inhibitors that are coming into place, and hopefully we get to see either higher efficacy or a better side effect profile as we get a little bit more specific with the pathway.
Yeah, No, I just think, I agree. I think some of these early phase drugs that we're starting to see that are much more specific for the mutations, you really do see a better side effect profile. I think it is important when you look at those molecular reports to not forget about, the AKT and PTEN subsets, right? The benefit was across all three populations, a strong efficacy.
How do you feel about PTEN testing in ctDNA? And do you have any concerns with calls of loss in the context of ctDNA? I think inactivating mutations I feel comfortable with. Copy number loss, it gets very finicky, and some assays do a lot more with copy number calling, and some do a little bit, like those thresholds get varied. Do you feel any particular way of PTEN loss in the context of ctDNA testing? That's
interesting. I hadn't thought about that specifically. I mean, I think ctDNA testing broadly, as you said, looking at that tumor fraction, are you really looking at something that's real? Yeah. I mean, I think that's, to me, the hard part is as you pick up some signals, are those real signals? And I think that's why I do love it if I have tissue to sort of help look at some of those questions.
And if you've used a PIK3CA inhibitor, are you testing post-progression to see if, because we know one of the acquired resistance mechanisms to PIK3CA is PTEN loss. And so in that situation, would you then ever think of sequencing and utilize an AKT inhibitor afterwards?
That is really interesting. I haven't done that, but it's intriguing to think about. I mean, I think that will be part of the sequencing question, right? As we get more drugs and thinking about resistance mechanisms, what does that, next iteration, post-progression look like?
I've done it a handful of times, and it's, we can still see benefit of targeting the pathway. And I think this just speaks to exactly what you're saying. We don't quite know when, or who might gain from hitting a different protein in that pathway.
Yeah, resistance is complex. I think we all pretend we can understand endocrine resistance in breast cancer, but
Agreed.
Yeah. I don't think we're there yet.